Before we begin official proceedings, I'd also like to acknowledge the traditional owners of the land on which we're meeting today, the Yagara and the Turrbal peoples, and pay my respects to their elders past and present. Now, hopefully most of you know that the Heart Foundation, we're the leading heart health charity in Australia. This presentation really is a fantastic opportunity while Dr. Schneider is visiting Australia to have him present on the really great importance of prevention of heart disease, and particularly that mind-body-spirit linkage. The Heart Foundation this year released 2 position papers on psychosocial health, with really one of them linking the relationship between depression, social isolation and lack of social support, as well as acute stresses with the risk of heart attack and heart disease. And the second one highlighting the high prevalence of depression of people who already have had a heart attack and the need for screening those patients and then offering treatment to reduce that risk. So I know that Dr. Schneider's presentation is going to be very interesting and very well aligned with the Heart Foundation's priorities and information. So just a little bit about Robert Schneider, and I know it's not really doing him justice on one page of notes, but I'll try and keep it brief and he can tell us any more anecdotes that he'd like to share. Robert Schneider is a physician, he's a scientist, he's an educator, and he's one of the world's leading authorities on scientific natural approaches for heart disease, for high blood pressure, for stress and other cardiovascular risk factors. Over the last 20 years, he's actually directed nearly $20 million into research grants from the National Institutes of Health in America for his pioneering research on natural approaches for heart disease. The results have been published in more than 100 articles in authoritative medical journals and proceedings, and he's also a bit of a media tart. He's been in over 1,000 television, radio, magazine and newspaper reports, including The Project in Australia this week for BC while he's been in Brisbane, but also the ABC's 2020, CNN, Fox News, New York Times, you know, just those little things. He's board certified in preventive medicine. He's a certified specialist in clinical hypertension, and he's a fellow of the American College of Cardiology. He did his postgraduate training in internal medicine and hypertension at the University of Michigan Medical School, and he was one of the first physicians to actually, in the United States, to train and practice, I'm going to get this wrong, but in Ayurveda medicine.
Ayurveda,
I'm so close. He has been a consultant to numerous government agencies, including the National Institutes for Health, who funded a lot of your research, the Centre for Disease Control and Prevention, and the Presidential Commission on Complementary and Alternative Medicine, as well as the US Congress Prevention Coalition. So without any further ado, please welcome Dr. Schneider. Oh, actually, I should say, sorry, a couple of housekeeping things. Firstly, can you please make sure your phones are switched off or on silent? We are filming today's presentation, so can you try and minimise coughing, sneezing, playing around with your handbag, and talking. And but just be aware we're only really filming Dr. Schneider, so you don't have to worry that your face is going to be on there. But we will have time after Dr. Schneider's 30-minute presentation for questions. So Dr. Schneider will repeat that question just to make sure that we capture it on video. So please welcome Dr. Schneider to give his talk.
Good afternoon, or as they say, I think around here, good eye. Mates. It's a pleasure to be with you here in Brisbane at the Heart Foundation. And it's really very exciting to know that the Heart Foundation in Australia is broadening its perspective and really helping to lead the way in the understanding of the role of the mind and body connection, the brain-heart connection, and how that contributes to health and disease. And today we'll be talking about how we can use the mind-body connection in a holistic way to prevent heart disease, lower blood pressure, other risk factors, and prevent heart disease. The big news from the United States that is one of the main messages that I've been asked to come to Australia to share is that the American Heart Association, the parallel organization of the Australian Heart Foundation, has reviewed all the scientific literature on alternative methods to lower blood pressure. And they published their scientific statement just 2 months ago. Online was in April, and in print was in June. And in their review of alternative treatments, they concluded that alternative treatments that include the transcendental meditation technique are recommended for consideration in treatment plans for all individuals with blood pressure greater than 120/80. Well, that is a big step, because this is the first time that any National Heart Foundation or medical organization has reviewed the literature on methods that were previously thought to be complementary and alternative, and have now said the evidence is sufficient today that we can say that some of these methods actually work based on conventional scientific criteria, and we're in a position to recommend them to our doctors in our association, and for our doctors to recommend to our patients for consideration in their treatment plan. And in this case, for all people with BP who are greater than 120/80. And how many people have blood pressure greater than 120/80? A lot. Actually, about 60% of the population in Western countries have BP in this range. Well, not only has the American Heart Association reviewed this scientific data, but the Wall Street Journal has also reviewed this data. In a cover story in April 15th, they said, doctor's orders 20 minutes of meditation twice a day. So this kind of mind-body approach is now becoming mainstream. And I want to share with you the thinking, the theory, and the evidence behind that today in ways that you might be able to use here in Brisbane and here in Australia more generally. First, the paradigm. Here's the model from this comprehensive system of healthcare. It was mentioned in the introduction that this form of meditation comes from the ancient Vedic tradition or Ayurvedic tradition, the world's oldest continuous system of knowledge and healthcare, and which has practical technologies that have been rediscovered in the present time and reevaluated and scientifically investigated. The model here is that the mind is connected to the body, not too far out. That our psychosocial stress affects physical health, and that's what the Heart Foundation just came out and said. It's been shown scientifically, and that's been also said for thousands of years. The other point is that the body affects the mind, and that's what many psychiatrists do, and GPs. You give a medicine, which is a physiological approach, and that can calm your mind or affect your depression. Also, if you eat too much and feel dull, you get tired, that affects your mind. So or if you're arrested, that also affects your mind. So the body affects the mind, it goes both ways. Third point here is the quality of our environment affects our body and our mind. For example, coming into springtime in Brisbane affects one's mind and body, as opposed to winter in some parts of the United States. But also we know about sick building syndrome, the quality of the building and toxic materials affect mental and physical health. Even the community that we live in, the level of stress in our community, it's been found that people who live in areas of high stress have higher blood pressure than people in the same city living in areas of lower stress. So the public health environment affects our physical environment, our physiology, and our psychology. So these three interact with each other. And then the fourth point, the new information here, particularly from this meditative perspective, is that there's a level of inner intelligence in the body. A settled state of mind, a settled state of body, and by experiencing this inner state, which some physicists call the unified field, natural law, this inner level of intelligence in all of nature, that like the DNA contains the inner intelligence that governs the whole body. Like that, physicists say there's a level of nature. Unified field theorists are describing it. Superstring theorists have suggested this. Specifically, here's where the knowledge, the information, the intelligence of nature resides and then expresses itself. If we can reconnect our bodies, our minds, and even the environment with this level of the inner intelligence of our physiology and nature, then we can restore balance in improve our self-repair mechanisms, homeostasis, and we might have an effect on mental health, physical health, heart disease, and even other conditions. So that's the theory, that's the model, and according to the scientific paradigm, there have been many experiments testing this theory. And that's what I'm going to show you now. First, what is this meditation anyway? There are many forms of meditation out there. Meditation is traditionally described for thousands of years, for example, in the ancient tradition of yoga, but also just about every other major tradition. And here, from this point of view, yoga, or the meditative state, is the least excited state of consciousness, or pure consciousness. That's been said for millennia. Now, in 2013, what people are doing in the West and around the world is this traditional meditative technique in a modern context. And what people describe is they start at an active thinking level of mind, and then during the meditative process, experiencing quieter and quieter states of mind, more settled mind, until they experience a silent inner state. That means settled mental activity, even no mental activity. That means being awake but not thinking. Just resting on a level of mind, not being hyperactive, not worrying about the past, present, and future. I know you're all thinking how great this presentation is today, but suppose all that mental activity could be completely quiet, and you're just awake, but resting on the level of your mind. If you could do that, and this is what happens regularly, systematic, easily, spontaneously during this practice, then you'd have all these physiological changes that have been described by scientists as a wakeful hypometabolic state. What do they mean by that? Well, this is EEG tracing showing results of a composite of dozens or scores of studies on the EEG during the meditative state, showing high density alpha waves, which means relaxed wakefulness, and also high synchrony or coherence between different parts of the brain, which is unique. In the body, there are changes in respiratory rate, metabolic rate go down. This is GSR, means the sympathetic nervous system, the adrenaline and noradrenaline parts of our nervous system have major changes compared to simply resting with your eyes closed, and compared to other meditative practices, as we'll talk about in a few minutes. This is biochemistry indicating reduced stress. This is change. So more change, in this case, reduction in the biochemistry of stress, more change, reduction, and more change also in reduction. So the body is deeply resting, the mind is wide awake. That's why it's been called a state of restful alertness, this meditative state, which is gained for 20 minutes, twice a day, morning and evening, by people practicing. And it's been called a fourth major state of consciousness because neurologists, neuroscientists know about waking, dreaming, and sleeping states of consciousness. Each of those has their own experience and their own physiology. Waking, the mind's awake, the body's awake. Deep sleep, the body's resting, but the mind's also not functioning. Deep sleep. And then dreaming is an altered state of awareness, and it's a middle level physiology. But in this case, there's what people describe as even expanded wakefulness, expanded alertness with no mental activity or less activity and deep rest, different from those other three. Subjectively, objectively, fourth major state. Preventive medicine specialists are now saying, many are, that the experience of this restful alertness for a few minutes twice a day is as important to health as sleeping, dreaming, and normal waking activity. Not as a substitute for any of those, but as an addition for full mental and physical health. So that's the acute experience, what happens during 20 minutes. Let's look at what happens over the long term, a few weeks, a few months, a few years of deeply resting twice a day, experiencing this fourth state. It's a study on blood pressure that we did 20 years ago, published in the American Heart Association's journal, classic study, and then I'll show you some replications. In this work, this were 102 subjects with high blood pressure, randomized to either education control. These people got instruction in what the heart foundations of every country recommend to their doctors, to their patients. Reduce salt, lose weight, get more exercise, and avoid stress. Is that correct? Standard lifestyle modification recommendations. They got a short course with some short follow-up. Second group got a course in progressive muscle relaxation. They learned to relax 20 minutes twice a day with this commonly used technique. And the third group got this transcending form of meditation for 20 minutes twice a day. These two groups were matched for time and attention. They both practiced the same amount of time at home, same instructional time, a 10-hour course over 5 days with some brief follow-up monthly. So same non-specific factors, same placebo-type factors. These are the blood pressure results over 3 months' time. No change in the education control group, which is often seen in usual care clinical practices. The muscle relaxation group had a small but significant change in their blood pressure. And then the restful alertness group had about twice the great reduction in systolic blood pressure and diastolic blood pressure compared to active control and compared to usual care instruction. So there seemed to be something unique in this restful alertness, this fourth state, beyond or different from relaxation in blood pressure. And when the American Heart Association reviewed not only the trial from 20 years ago, but the latest meta-analysis of dozens of studies from the past few years, they concluded that the transcendental meditation technique is the only meditation practice that has been shown to lower blood pressure. Well, where do they get that from? Here's a meta-analysis. That means a study of all the published literature of relaxation and meditation techniques that have high quality scientific designs. There's some technical points about the quality of design, the rigor, the replication, similar design characteristics that a drug would have to go through to get government approval. So when you look at those high quality studies, this is what the authors found, that in the areas of muscle relaxation, stress management, biofeedback in this study, and combination treatments of these various forms, there is no significant effect when you look at the randomized controlled trials of those meditation and relaxation techniques. However, when you subject this restful alertness kind of meditation to the same rigor, the results are highly significant in reducing blood pressure. And reviewing this and related data motivated the American Heart to say other techniques either have insufficient data or negative data for their effects on blood pressure. We just can't recommend them at this time beyond this particular one in this category of mind-body intervention. That was a bit about blood pressure. Our model today is that the mind and body affect each other. This is a meta-analysis or big study of all the published literature on anxiety. We've heard about psychosocial stress. Anxiety is another risk factor for heart disease and hypertension. This was done by the lead author at Stanford University, comparing the scientific studies on various meditation, biofeedback, progressive muscle relaxation, other meditations, relaxation response, the kind that you can learn from a book or a CD or probably YouTube now. This is the kind of self-learning technique. Relaxation, most of them have effects on reducing anxiety. First point. Second point is placebo also has an effect in reducing anxiety. In the mind-body field, thinking of drugs that treat anxiety or depression, what percentage is related to placebo? Maybe around 30%. So placebo is a known effect, and has effects on reducing anxiety, and those techniques are similar. Notice something here, that this transcending form of meditation, going beyond ordinary thinking, experiencing this restful alertness, has greater effect on placebo than the average of other techniques in this meta-analysis of scientific literature. Fast forward a few years, this was a meta-analysis, a review of all the published literature. For those of you who are technically oriented, this was a systematic review and meta-analysis of all available scientific literature on meditation techniques available within the past year or so. And this group out of Germany, they looked at a composite, and then also with a letter to the editor, they looked at a composite of psychological stress and health. This is both negative traits and positive traits combined for index of psychological health. And in this study, mindfulness meditation has a lot of published literature, and it has a modest effect on improving psychological health. There's not so many literature or studies on other meditation techniques individually, so they were combined in this analysis. Other meditations had a similar and modest effect on improving psychological health. Here we see the restful alertness kind of meditation, and with the latest published data, has a significant greater effect on improving psychological health, which parallels the blood pressure findings that we looked at earlier. So there's something unique here, creating inner balance, connecting with the body's own inner intelligence, restoring the body's self-repair mechanisms is the theory for why we can see these unique effects on mind and body. There are other risk factors that are important, but diabetes is a major chronic disorder that I think the Heart Foundation is concerned about, and everyone should be concerned about. It's thought that the basis of diabetes is insulin resistance, especially in adult onset diabetes, which is occurring earlier and earlier now, non-insulin dependent diabetes, due to resistance to insulin. This was a randomized trial sponsored by the U.S. National Institutes of Health, done in Los Angeles, in collaboration with Cedars-Sinai Medical Center, taking heart patients, randomly assigning them to conventional education and meditation before and after 16 weeks, looking at their insulin resistance. And as you can see in this slide, there was reduced resistance to insulin in the meditation group, which is positive. You don't want to resist your own insulin, you want to be sensitive to that. So changing that insulin resistance has a lot to do with modifying blood sugar control. It has a lot to do with preventing diabetes, if this were to continue. It has a lot to do with metabolic syndrome, which is this combination of obesity, high blood pressure, pre-diabetes. It has a lot to do with also preventing atherosclerosis, coronary heart disease long term. So this may be a biochemical basis or mechanism for some of the changes we've seen in some of the other clinical studies. Not only that, but the American Heart Association in its June 2013 report pointed out that lower blood pressure through transcendental meditation practice is associated with substantially reduced rates of death, heart attack, and stroke. Now that's why we're doing all this prevention. And it's not the high blood pressure that kills people, it's the damage from the high blood pressure to the heart, to the brain, leading to either non-fatal heart attack, stroke, or fatal events. So, this past November, there was a major study published that answered this question that the AHA was referring to. I'll show you what that is. This was published in the American Heart Association's journal, one of their top journals, Circulation, Outcomes, and Wellbeing, and funded by the National Institutes of Health for 10 years. And in this study, our colleagues at Medical College of Wisconsin and our group looked at a particularly high-risk group in the U.S., African Americans. However, in every country, cardiovascular disease is now the leading cause of death. In Australia, one of your main messages here at the Heart Foundation is to convey to men and women that the leading cause of death is cardiovascular disease. So these results are applicable to every major population group. 201 subjects were recruited, randomized, all continued usual care, all had heart disease. They all were tested by their cardiologist by angiography, looking at the coronary vessels, had significant blockage. And we followed them for 5 years. 5 years each subject, although it took 10 years to do the whole study, because people came in at different times and left at different times. Here are the results. 10 years, and these are the number of people alive, percentage of people alive at each time. The red is the control health education group. Blue is the meditation group. Again, all subjects continue their usual medical care with their doctors, medicines as recommended, and then they added these 2 non-drug programs to their medical programs. So at the beginning of the study, time 0, all the subjects were alive, fortunately. And then the red line shows the survival rate, event-free survival rate over the 10 years of study. The blue line is the event-free survival rate in the meditation group. So as you can see, there's a significantly higher survival rate in the meditation group. This chart says the same thing in a bar presentation, a little simpler to get the main point. This is the events, cumulative death, heart attack, and stroke over that time period. This is the cumulative rate in the meditation group. 48% reduction in rate of all-cause mortality, non-fatal MI, heart attack, and non-fatal stroke. This was big news, and it went around the world. I'm sure it came to Australia. It's coming to Australia now. That these effects are as great as standard medications used for the secondary prevention of heart disease. If you already have heart disease, most doctors will recommend cholesterol-lowering medications, blood pressure-lowering medications if you have high blood pressure, aspirin or anti-clotting medications. Those medications have similar effects, similar or less effects, although they have more studies, but the effect is the same or slightly less on average. But the point here is that all of these patients were taking those medications, standard medications already, as prescribed by their doctors. So this is an effect on top of standard care. It's as if this is the discovery of a whole new class of medication, in this case from the body's own internal pharmacy, if you will. And again, theoretically, by restoring the self-repair and rebalancing mechanisms from within at this mind-body basis, that people are waking up with this meditative experience. Not only was there 48% lower event rate, there's a reduced blood pressure over 5 years with this form of lifestyle modification. Reduced psychological stress. Anger is also a major risk factor for sudden cardiac death and chronic coronary disease. And there was a dose-response relationship. That means the more that people meditated, the more response they had, the more regular they were to an optimum level of 20 minutes twice a day. Those who were less regular had less effect. And actually, when you look at the highly regular people, closer to twice a day on average, they had a 66% reduction, and this 48% is the average of everyone. However, the majority of people in this study, over their own participation time of 5 years, were regular, once a day or greater, which was sufficient to have this average effect of almost 50% reduction in deaths. Now, you might ask about, this is Great, but what about other meditations? We looked at some of the meta-analyses before on mental health and blood pressure. This is a systematic review of literature on EEG changes, looking at changes in the brain with different forms of meditation. Because the theory here, again, is that the brain is connected to the heart. So changes in the brain are reflected in changes in the cardiovascular system. That's modern neurocardiology. So the neurologists and neuroscientists who've studied different forms of meditation and published their work in the past 2 years or so categorize different meditations in three broad areas. One is called focused attention, the other is open monitoring, there's automatic self-transcending, based on the level of cognitive control. That means how much effort is required in that meditation. So in the case of focused attention, people are putting a lot of work during their practice into focusing their mind, focusing their attention on a thought, a mantra, a sound, a sight, focusing on emptying their mind of thoughts. It's kind of hard work. And in that focused attention method, with all this cognitive control, the average EEG by scientists who study those meditations are in the gamma range. That means fast EEG, as shown in this representation. Second category is called open monitoring. This is popular in some parts of the world now. Sitting and observing your thoughts, observing your breath, observing that you're separate from the world, from your thoughts, from your breathing, from your emotions, your feelings. That monitoring or observing is a middle level kind of mental activity. This is more of a mindfulness type of meditation. And those people who study mindfulness and monitoring report this kind of EEG, a theta pattern, which is different from the first one. And it's different cognitively. Third category of meditation has the least cognitive control. It's said to be effortless by the practitioners. Here you're not working at all. That's why it's called automatic. The practitioners say, the teachers teach a way to start, and then the rest happens by what seems to be a neurological reflex to settle down and become quiet inside, kind of fall awake, if you will. And that's more technically called automatic self-transcending, transcending that ordinary brain pattern. And that group of meditations, represented by transcendental meditation in this case, most prominent form, is associated with alpha 1, kind of alpha wave, 8 to 10 hertz. The main point here is it's a different EEG pattern associated with relaxed wakefulness, where those other EEG patterns are associated with more mental activity, be it middle or high level. So we have varying levels of mental activity depending on the practice. And in the cardiovascular system, we see varying levels of effects on blood pressure, which corresponds or parallels this. And in the psychiatric literature, or the clinical psychology literature, you see varying effects on anxiety and varying effects on psychological health. So, different practices appear to have different effects on mind and body. Each may have their own value according to individual desire and characteristics. But today we're reviewing the cardiovascular related outcomes, and that evidence is quite clear for the effects of this restful alertness on cardiovascular health. Well, we can't stop there. The new trend of medicine is looking at DNA. Genomic medicine wants to look at the deepest level of our physiology. There's a whole field now of epigenetics, how we might change our DNA, actually changing our DNA expression, whether genes turn on or off. It's been discovered we can have some effect on through our environment, whether the toxins in our environment, or the food we eat, or our kind of exercise. A group of investigators led by a PhD student at our university in collaboration with Howard University in Washington, D.C., looked at effects of lifestyle and meditation on gene expression for telomerase. Telomerase is an enzyme that repairs the DNA and repairs the telomere part of the DNA. The telomere is the tip of DNA, like the tip of your shoelace, that plastic cap kind of protects the DNA. And if you can repair it, it lasts longer, and the whole DNA is more intact. People tend to live longer, fewer chronic diseases, less heart disease, less cancer, with longer telomeres and higher telomerase. So it's very relevant to heart disease on a deep molecular level, the DNA level. So in this randomized controlled trial of about 40 subjects, the lifestyle modification group increased their telomerase, and that confirms other studies showing that effect. The news here is that the meditation group, who got a basic lifestyle course, but primarily meditation, were able to change their gene expression for telomerase, largely by using their minds, by experiencing this restful alertness state of the mind and body, turning on self-repair also. So this mind-body connection goes down to this subtle level of physiology, even to the DNA, which is expression of, material expression, we could say, of our body's own blueprint, of our body's inner know-how or intelligence. Many physicians, and most of us, want to have a comprehensive lifestyle program for maximum prevention. This was a study in the American Journal of Cardiology, published combining various meditation and related lifestyle measures for diet, exercise. Some yoga exercise was here, and this Ayurvedic diet, and some food supplements, antioxidant food supplements from this tradition, kind of a package, compared to a package of modern lifestyle modification using exercise and diets recommended by the American Heart Association, which I imagine is similar to the Heart Foundation here in Australia, it's similar around the world. Does conventional lifestyle with vitamin C, vitamin E, or supplements. We're in the second group, the modern group, and they had similar results to the usual care groups. They're combined in this slide. The outcome here was carotid intermediate thickness. That means the thickness of the artery in the neck, which shows how much atherosclerosis is there. Thick is a lot of atherosclerosis, but thin is less. And in this case, after about a year, this was reduction in the meditation-related lifestyle group, and here's reduction in the higher subjects who had a greater thinning of their walls. That means an opening up or regression of their atherosclerosis with this combination lifestyle modification program. So it seems even an additive approach has additive clinical effects. To summarize, today we've talked about a total heart health approach based on managing our mind and to help manage our body. We didn't talk about the environment very much, but our mind and our body affects our community and our environment, and there are these meditative-related approaches for even balancing the environment. But the key here is to balance the mind-body connection and to restore those innate healing mechanisms, those innate self-repair mechanisms, by experiencing this deepest level of the mind and body. It has unique physiological correlates and clinical effects, as we've seen today. That's the discovery. That's what we're talking about all over Australia these days, with a remarkable reception, and around the world also. And this is a representation of a hospital and a medical school that incorporates the best of conventional modern medicine with the best practices of natural medicine for prevention, health promotion, and treatment with minimal side effects and maximum side benefits. So I hope here in Australia, you're also able to take this knowledge, institutionalize it in the ways that you have here in the Heart Foundation, to use this to build and rebuild your own physiology, your own health and well-being, and apply this in your communities also. So thank you very much. Now we will take some questions. Comments? So someone in the back there was thinking of, yes, sir.
Tom Schneider, he's a professor of philosophy and law at New York University. He wrote a book last year called Mind and Cosmos, where he's been writing for years on the mind-body problem, and he argues there's no scientific evidence that the mind comes out of the brain. So he's not saying where it comes from. I think it's interesting when we talk about mind-body health, that the reason why we've had so little success, I think, is because we're trying to mix two things which are completely like oil and water. So his argument is that the scientific research has not, we know an enormous amount about the brain, billions of dollars of research in neuroscience, yet we almost know nothing about the mind. And the psychological and psychiatric research, I think, is useless. We don't have a good grasp on the mind in the Western world. So I think that if you're looking at mind-body medicine, you've got to be, if he's right, and I believe he is right, he's not saying where the mind comes from, but it is an autonomous entity. It's not, it certainly has correlates in the brain, we would argue against that. But I think, and I believe, we have to see the mind as an autonomous entity, and it's where human, I guess, comes in. And if it has physiological effects on the body, that's fine. But if we're trying to have mind-body science, if Thomas Nagel is right, it will be a complete failure. It will not work because you cannot combine two things which is so my advice, I guess, would be we should have a mind training. So cardiologists, for example, 95% of cardiologists are male. It's interesting to do today. 90% of the audience is female. So I think there's a decision among males about anything mental, in medicine in terms of GPs and specialists. So what I'm saying, I guess, is I think we should probably have some, if we were to do it properly, we probably people who are trained in the mind. I'm not sure how, not psychologists like how necessarily. And if you try and combine those too early, you will not succeed.
So to repeat for our viewing audience, if I can summarize a very eloquent comment. The comment was about the mind-body connection and whether the mind and body are separate or connected and where they are, and recommending that there be experts in the mind in medicine. So that's the point here, is that states of mind affect states of body, wherever those are located, they certainly affect. And that was the position statement that the Australian Heart Foundation came out with on Monday, that states of mind affect states of the heart. Depression, social isolation, I might add a few other risk factors, anger, anxiety. That's been shown for 50 years now. And then the point of today is that you can manage your mind, and that has effects on your body. And in ways that we showed today for cardiovascular prevention, going in a reverse direction. And then we can have some interesting, more philosophical discussions later on too. At least there's some practical implications, which agrees with your point of having experts in managing your mind in medicine. Some other questions, comments? Yes, ma'am.
I've never heard of transcendental meditation as a specific technique, so where can you get information about that particular type of meditation?
Right. Well, they're trained and certified teachers all around the world and all around Australia. We have some representatives today who've come to talk. Do you want to introduce yourself and say anything about where this is available?
Yes, my name's Wendy Rosenfeld. I teach Transcendental Meditation in Brisbane, also at Sunshine Coast and Gold Coast. And we've got a website, www.tm.org.au. So if you go to that, you can contact me. I run free introductory talks that go through the benefits of TM, how to learn, and also how it differs to other techniques that you might try before.
Thank you.
I believe it's going to be a follow-up meeting, perhaps here, for those who want to learn more about how to learn, and then some collected names. And then you can get more information right here in Brisbane through that channel, as well as the website. Yes, any other, doctor?
Yes, sorry. I'm a psychiatrist, and just following on as a comment, but also firstly, thank you for this very refreshing presentation for me at least, because it does show that there is some governmental funding in research that looks at preventive measures in health. And obviously the data you presented is solid data from a scientific standpoint, even if we don't have a clear definition of the subject matter, meaning the mind. You talk about a technique that shows obvious comparative benefits, beneficial results to other techniques like health education, and in my mind it's actually involving or inviting the individual to be involved in their own health care,
Yes.
which is what we observe in psychiatry. I experienced personally a very frustrating element in regards to research in psychiatry, because the research methodology applies to measurable data from an objective standpoint, viewpoint. And in psychiatry, there is a lot of subjective data and a lot of interpersonal elements that complicate or can influence this data. So I'm not sure if you can comment at all or are willing to on these aspects of technique and research methodology that might need a revision in order to really meet the whole group of researchers and integrate in a preventive approach that doesn't just measure objective, concrete elements outside of ourselves.
Good point. And for our viewing audience, our local professor of psychiatry,
I'm not a professor.
our local psychiatrist has pointed out that in psychiatry there's a lot of subjective information that's very important. It's not easily measurable with conventional objective methods. And that subjective, about subjective well-being and interpersonal information is important too. I can only say that certainly there are a number of qualitative studies on meditation where people report more about their experiences and their interviews and qualitative analyses, content analyses, and more case reports there, and that's certainly available. The doctors that I meet ask for the hard measurable data. In the psychological world, there are many more outcomes than I showed today that have been measured. Maybe broader from a psychiatric point of view, there was that composite index, which has several measures of negative health and positive health combined. So the index means high on the positive, low on the negative. That would be an interesting area to discuss if you find that's more rich. And I would point you to the qualitative, and sure, we should also do more to elucidate these states from a broader perspective too. Yes?
Hi, I'm a student of Ayurveda, and I'd be really interested to hear your views on how you see the uptake of Ayurveda and combining with the knowledge that we have now about mainstream healthcare, given that TM is now becoming into mainstream. Do you see the same thing happening with Ayurvedic principles?
I do. Our questioner is pointing out this tradition of Ayurveda, the world's oldest traditional system of medicine, thought to be the mother or father of other traditional health sciences historically, which has a lot of information that we can uncover and I feel practice and evaluate in a modern context. Low meat diet towards a vegetarian diet is one example that comes from this traditional system that's now being verified by many studies. Meditation comes from this natural system of healthcare, and that's been quite well studied now and made practical. So yes, I believe there are other elements of diet, exercise, lifestyle, nutritional supplements, which have begun to be evaluated and seem to be quite complementary and helpful. Yoga, exercises, even healthy architecture is there too, and even chronomedicine, chronobiology, our physiological cycles is very rich. So it's a very rich area. If you want more information, I happen to have written a book on the topic called Total Heart Health, which is available online or here in Australia, Dr. Carr can tell you, but online. And in that, my co-author and I talk about self-care methods for lifestyle, diet, exercise, supplements from this traditional system of natural medicine, and we quote the scientific support where it's available.
I can add also that Dr. Schneider will be training doctors tomorrow. There's a 3-hour workshop that he'll be running on how to apply these Ayurvedic principles into their regular practice.
So there'll be a training course here. And Dr. Carby is a physician here in Australia and is an expert in meditation and this Ayurvedic approach. We'll also be offering more in-person courses for the general public and professionals. Yes? Anyone else?
Do you think people who are interested in TM and meditation are a special subgroup of the population anyway? So that's a bit of a popular research, isn't it? You know, it's a patient comes up to me and says, I do TM. That's we call 001 patient population is a general practitioner.
Mm.
So it's sort of a, you know, I think that's one of the problems in research into these areas. People who are attracted to that are already so it's just supposed to. I know you can try and control for that. But I think people who have a mental bent already probably are going to be healthier than people who are
It's a good question, and it's about self-selection, effectively. And in ethics of all modern scientific research requires volunteers. The days are over when we can corral people into scientific research. So using modern ethical practices, people have to volunteer, so they have to be interested in the study. However, you can measure expectancy in some crude way, and then you could look at outcomes based on expectancy. And so far, there's no relationship where it's been studied between expectancy and outcome, between placebo type effects and outcome. So that's the best we can do that I can think of in a scientific context. We've worked in our studies with a broad range of people, ethnic minorities, low education groups, low income groups, as well as high income groups in Los Angeles. And you know Los Angeles, there's north and south. We worked in Beverly Hills at Cedars-Sinai. That was one of the papers I published. High income group, movie stars tend to live in that area. We've also worked in South Central Los Angeles, which is where the riots were several decades ago. Low income, showed another study from there, or work from there. So it looks like there's a broad range of socioeconomic status, education levels, and age group also. Any other comments? Yes?
Well, like any therapy, how would you describe compliance?
Compliance. It's a really good question. And compliance with lifestyle is tough, generally. And I know your work and with the Heart Foundations try to get people to change their lifestyle and stick with it. And it's a big job. And many doctors give up, sadly, amongst my colleagues. Some don't start. Right, here, take this pill. Take this exercise pill.
For the 30-minute walk, yeah.
Yeah, a 30-minute walk.
Take your pill with the 30.
Aha, take it right. So, again, we're supporting, this is just continue usual medical care. But in terms of compliance with lifestyle modification, the point is it's generally tough. However, with this particular practice, people don't have to go out and be active and be sweaty or go to a gym. It's something that you can do wherever you are, in your office, every day, on a bus, on a train, on a plane. We've meditated on a lot of planes in the past 10 days. So it's easy, comfortable, the learning is easy. People enjoy resting, relaxing, they're refreshed afterwards. It's self-reinforcing. In our heart trial, our cardiovascular events trial, about 75% of the subjects practiced at least once a day or more over 5 years. So that's pretty good. And you can see the biomarker of that. Blood pressure stayed down. So the self-report correlated with the biomarker as well as psychological markers. So I would say, based on studies, there's a relatively high compliance compared to even lifestyle modifications or even other interventions because of the self-reinforcing enjoyable life. Any other comments? Yes?
I know there's a mindfulness app. Is there an app for transformation?
A transformation is an app. I believe there's an app to find a certified transcendental meditation teacher in your city. There's certainly a website. What was the name of the website again? tm.org.au in Australia. You can sure get that on your iPhone. However, what we have found in our literature review is that when people, and in our experimental experience, that when people learn face-to-face, the teacher's there to guide the student according to their pace of learning and their own particular experiences, it's a lot more effective. And, we're managing the mind here, so so you wouldn't want your neurosurgeon practicing from an app. You'd want him or her personally trained, working on you personally. So that's what seems to be best with this meditation. Any other comments or questions?
Robert, have there been any adverse side effects to you?
That has been evaluated. There was a large study in Sweden of psychiatric hospital admissions. They have centralized health records in Sweden, as they may have here in Australia. So you can really look at a whole millions of people. And when they look at health records of psychiatric hospital admissions, there was no greater proportion, even perhaps a lower proportion of people practicing meditation. Psychiatrists use this in their practice under supervision, and there are no known or documented adverse side effects of resting and relaxing twice a day. Yes. Good question. Well, pleasure.
Thank you. Will you please join me in thanking Dr. Schneider? There's a small gift.
And I just want to finish with a few additional thank yous. I'd like to thank the Cancer Council for allowing us to use their auditorium today. I'd like to thank my staff who've organised today, and also Dr. Carr, I guess, for getting in touch with us about Dr. Schneider's visit. As you said, you've utilised his time well across the country. He's been on a very busy schedule. We're lucky to have been able to slot in with him. And as mentioned by Dr. Schneider, we have had the offer through Dr. Carr, if anyone today is interested in learning more and actually coming and doing a practical session on transcendental meditation, we can organise that through one of the trained practitioners. So I think probably the best approach will be that we can organise a time that's appropriate in a venue, and we can send information to the participants today about their interest and availability of that as well. So hopefully you've learned that mind over matter is very important for the body and the brain and the environment, and we hope you all go home in peace and have some rest and relaxation wherever you may do it today. Thank you very much.